Hi there, welcome in. And first, I want to start with just apologizing with the holidays coming up. Our clinic has been a little low staffed. Were you able to get your appointment scheduled okay? Okay, good. And usually we have a nurse do this, but like I said, because we're short staffed, your doctor, am going to be doing that. Just double checking and kind of getting you ready for the appointment first. So can you just confirm your name and date of birth for me real quick? Perfect. And then have you had any changes in address or insurance? No? Great. Okay. I'd also like to apologize if it looks super informal because I spilled coffee on my white doctor's coat earlier. So that was really upsetting. So now that's why I'm kind of in warm street clothes. So please excuse my unprofessionalism. Promise I'm still a doctor. Okay. So, why don't you tell me a little bit about why you're in today? I see that we're doing an STD check. Okay. Yeah. Have you had any symptoms, or is it just a checkup? You have a new partner? Okay, so you have been experiencing symptoms. What have you been experiencing? Okay, so you've been experiencing some discharge from your penis and a little bit of a burning sensation when you use the restroom. Okay, all right. So then I think to start this, I'm going to have you do a urine sample because that's going to be able to check for a lot of the most common STIs that there are. Usually things like this, like chlamydia, gonorrhea, syphilis, we can check through a urine sample. So I'm going to give you this. I'm just going to have you go into the restroom over there. And if you feel like you can use the restroom right now. Yeah, okay, great. So just go into the restroom. There are caps in there and then stickers. And you're just going to pee into the vial and you'll just place a sticker on there and then write your name and date of birth on there for me. Okay, I'll be waiting out here. Everything go well in there? All right, so let's just begin with some few questions. So how long have you been having these symptoms? You started noticing like a couple days ago, like 2-3 days ago? Okay. And when was your last sexual encounter? Okay, about 10 days ago. Yeah. So for things like chlamydia, usually the incubation period of when you're going to show symptoms is 7 to 21 days after your after intercourse. So that falls about right in line when you would start showing symptoms. So that moves into my next question. Have you been having unprotected sex? Okay. Yeah, that's is gonna be a risky factor and lead into you and your partner contracting more STIs. Yeah, so I'm not judging at all, but just from a health standpoint, it is very important, especially with new partners or flings, to either get checked beforehand before you have intercourse or use a form of protection, a condom, a dental dam, something along those lines to protect yourself and others, because STIs, especially unchecked ones, can lead to bigger problems, infertility, or you could happen to contract something a little more dangerous like HIV or syphilis. Yeah, so it's really important to get checked. Yeah, when you're gonna have a new partner or frequently, yeah, if you engage in kind of risky behaviors, not only like sexual encounters, but any kind of needle sharing, whether it be from drug use or going to maybe less than reputable like piercing places or tattoo shops. Yeah, it's just very important to take care of your health and keep track of what's going on with your body. And especially for STIs, a lot of the times they don't even show symptoms. So you could be passing things on to partners that you didn't even know. Okay, all right. I think you get it. That's enough of my little lecture. So we're gonna move into just the kind of checkup portion of this. I'm gonna check your heart rate and your breathing real quick. 1 second. All right, I'm gonna kind of warm this up in my hands for a few minutes because I know it can be super cold and that's not fun. Okay, I'm just gonna check your heart first. So I'm just gonna kind of get a little close and you can just breathe normally, okay? Okay, everything sounds good. Now I'm gonna check your breathing. So I'm gonna put this on your chest and just take some big breaths in through your nose and out through your mouth, all right? Okay. And deep breath for me. And release. And deep breath in. And release. Okay, I'm gonna change to your other side. And deep breath in for me. And release. And deep breath in for me. And release. Okay. That's all sounding good. So, if you are prepared and feel comfortable, I would like to do an examination of your pelvic area. I think we should also, along with the urine sample, take a sample of your discharge. So I'll just swab the discharge off the head of your penis. Yeah, and just so I can check in case there are any sores, abrasion, any tenderness that you're having, pain. Yeah, any swelling of testicles. But that's usually a rarer symptom, but could be there. Yeah, okay. So I'll just go have you undress in there. There are gowns. They're in little packages. You can just rip them open. They're all sanitary. And then come on out and we will do a really quick pelvic exam and then get you on your way. The testing comes back very quickly, so we will know in the next few hours and get you probably just an antibiotic. Because usually, especially with young people, chlamydia is the most common STI, and discharge and a little burning while you urinate do lead me to think chlamydia, but we're gonna do the testing to make sure. Okay, so yeah, go ahead and change and we will just take a quick look. Perfect, you're in your gown. You can just remain standing. I'm gonna get gloved and ready to go. Gloves are getting difficult to get on today. All right, and I'm just gonna have you raise the gown for me. I'm just gonna start by taking a look. I'm gonna use my little pen light that I have here and just check if there's any redness, any sores, abrasions, because I will also need to swab any sores as well. Okay, and then I will do a little bit of a palpation just to see if there's any pain there, okay? All right, let's begin, but this starting with just looking, okay? And, oh, I'm sorry, as always, let me know if you ever feel uncomfortable, if anything is a little too painful and tender, let me know. We can totally stop, take a break, or, completely end the exam as well. This is your health and whatever you feel comfortable with in this examination. All right, so let's begin. Just gonna look. Everything looks so far visually all right. I can't see that, yeah, there is on the head of your penis some discharge coming out of your urethra, obviously. So I will be swabbing that. And then I will do a quick just palpation of the penis and testicles. Just to make sure everything is all right, okay? So I'm going to use this little swab just to collect the discharge real quick. So I will be touching you. Is that all right? Okay. Let's go ahead and get that done. It's going to be super quick. We're just going to swab swab, swab, swab. Okay, great. And I'm just going to put that into a sanitary vial for the lab to test that as well. And now I'm going to begin the palpations. It's not going to take very long, just a few seconds. All right, I'm just going to go down the sides and then the top and bottom. And then we'll do a little feel of the testicles and we're all done. Okay, let's begin. So now I'm just going to be palpating down the sides of your penis and let me know if anything is tender. Still doing all right? Okay. And now the top and the bottom. Nothing tender. Okay. Okay. Yeah. All right. And then now just a quick feel of the testicles. Just start here. Okay. And then the other one. Still doing all right? Okay. All right. I don't feel any lumps, bumps, any redness, abrasions. It doesn't look like you have any sores or, any other symptoms that would lead me to believe that there is anything else going on. And we're gonna, see back from the tests. I think you probably just have chlamydia, and that's just gonna need an antibiotic. So it'll be a 1-day antibiotic, just one pill, and you'll just take that once you pick it up from your local pharmacy. And I would just say refrain from having any kind of sexual intercourse for about 7 days after you take that antibiotic, just to really make sure that it cleared everything out of your system, because it doesn't work instantly, so you can still spread that. Do you have any other questions for me? You should be getting a call from the nurse probably within the next couple of hours. Yeah, and then they will write that prescription to whatever your preferred pharmacy. Let me see, do we have that down here? What is your preferred pharmacy? Okay, yeah, we have that written down in our notes. Perfect. So thank you for coming in. I wish it was for a little more of a happier, easy visit, but yeah, we're gonna get this taken care of really quickly. I'm very proud of you for coming in and getting checked. If the partners you've had intercourse with recently, you may want to alert them that they may need to get checked out as well, just so things don't keep spreading around. Yeah, but it's really good that you came in to get checked out. Yeah, and we'll get those taken care of for you super quickly. So I'll see you back here in the office, hopefully for your checkup later. All right. Bye-bye.